excited to hear from Ashley DaCosta, who's an RN, has her MSN degree. Ashley is the clinical lead at Interior Health Authority in Kelowna, British Columbia, and she's also one of our amazing PhD students here in the School of Nursing at Trinity Western University. And she's going to be sharing with us about commissioning healthcare facilities, implementing a planetary health lens. Thanks, Ashley.
Good afternoon, everyone. As Kendra said, my name is Ashley DaCosta. I'll be presenting on commissioning healthcare facilities, implementing a planetary lens, and I wear my glasses on purpose today. And I'd like to acknowledge the lines that were on the stove of people. And these ones are so special to me because I came on them about, I'm going to date myself, 25 years ago as a young, small-town girl who later graduated with her bachelor's in nursing and then came back for my new master's, and I just couldn't get enough, so now I'm here as a PhD student. Cheryl did say there might be a diamond program after. But yes, there's such special lines, and I'm so grateful to be on them. I want to acknowledge my wonderful team. My dear colleagues, Kathleen, Lounsbury, the Indigenous Curriculum Consultant here at Trinity Western University, and Dr. Astle, the Director of the MSN program and Professor of Nursing here, who you all know well. Thank you to them for their expertise on my presentation today. And I'd like to situate myself today. So I'm a second generation immigrant from Portugal, and I have a huge family. And it was my grandmother's 90th birthday this past summer, and so we all got together. I have 21 cousins on this side, and I wrote 26 on here, but actually it's 27. They have 27 children who I'm an auntie of, and there's one on the way. And my responsibility in being their aunt is to steward the lands and teach them the Indigenous ways and uphold them, and that's why I'm showing you my family. And also, I grew up in Kitimat, BC, the land of the Haisla Nation, and I call Kelowna home, which is the land of the Silks Nation. So just wanted to recognize all those places. So as Kendra mentioned, my role is clinical lead with Interior Health, and I am involved in hospital and healthcare, expansions, renovations, anything that comes your way. I get a lot of questions. It is a random role, very unconventional, but I love it. I've been doing it for almost 10 years, and I'm involved in when they develop a business plan, and then right through the intricate process of design, and then construction to keep operations going, which is very difficult at times, and then right into the commissioning or opening of the new facility for patients and staff. The lens that I bring to this role and the experience that I contribute is holistic and it's systematic, and I bring some things that I do, I guess, is I assess and align healthcare service expansion, so do we need new services in places? I assess operational workflows, which is very important, in order to create an efficient design. I work with the clinical staff to communicate the vision, guide them through decision-making, and preparing them and encouraging them to sit at the table that is full of many different disciplines. I collaborate with architects on standards and design, and with engineers on things such as medical gas load consumption, air changes and pressures, keeping you safe through COVID, lighting zones, technology, infrastructure, patient life safety systems, materials inside the room, and I know way too much about toilets. I know how high they are, how they're mounted, how far away the walls need to be. But all jokes aside, my goal is for projects to ensure that the facilities we design are honoring, inclusive, and a place where everyone is welcome and feels comfortable to come and receive care. Also, we want our facilities to be state-of-the-art. We want them to have all the technology that is needed that improves the patient and staff experience. And a very special part of my work is that I get to partner with the local Indigenous nations to ensure the spaces are reflective of how they see the land. I advocate for Indigenous inclusion and engagement throughout the entire project, and the integration of the Indigenous ways of knowing into the design, the staff training, and the opening of the new facility. So for my presentation today, I'd like to go on a walk wearing our planetary lenses.
Nice.
And planetary health, as we know and we've been hearing about, is the interconnectedness of human health and the environment, and disruptions to our environment are making us sick. Healthcare facilities are the most energy-intensive building types. And currently the main focus is on the industrial building system, emitting low carbon. Very little attention is given to the planning and the developmental stages and the activity that's going on inside of the building. So for our journey today, we're going to start from the outside of the building, and then we're going to move inside. And we're going to consider what is green, meaning what is contributing to our wellness and healing, and what is not, and where there may be opportunity for change. So we start outside the building with our feet grounded on the earth. We are led by the local Indigenous people who have stewarded, protected, and preserved the land for centuries. Together, we stand outside the hospital. We notice the local Indigenous language on the outside of the building and the animal hieroglyphics that honor our first people and tell the story of the local lands. Underneath the animal hieroglyphics, we notice the gardens alongside the building and inside the roundabout. They are in bloom. They have local Indigenous plants that can be harvested in preparation for ceremony, which can occur in all but 2 rooms inside the building. The large tree on the green, the lady the green tree, the lady in the orange dress, is a designated space for outdoor ceremony, so for drumming or smudging. And then as you enter the facility, which is the emergency entrance, your eyes are drawn to the medicine wheel light fixture. This connects the land to the inside spaces and emphasizes that you are entering grounds that honor healing and traditional practices. You look down the cultural corridor that is filled with art and artifact displays, which highlights the vibrant community culture of the communities. You see a curved wall made with materials to represent basket weave, a craft that is embedded in the heritage of the culture. A friendly nurse opens the door. It says triage. Let's go inside. The triage interview and triage examiner are cleverly joined by a door. In case a patient is very sick, we can move them over into the bed. You can see where the bed is, and then they can lie down in case they need medical testing, diagnostics, blood work, that kind of thing. Applying our planetary health lens, we are reminded that almost every patient that comes in the hospital is going to come through this room. Thinking about that, we wonder, oh my, what's wasted? Definitely gloves, definitely disposable wipes, paper towel, a thermometer plastic cover, and if the patient's even sicker, oxygen tubing, needle for IV work, ECG, cardiac leads, that kind of thing. We look at the equipment. There is lots in the room. We think about, what is it made of? Is it toxic? What are the environmental commitments? Where was it purchased from? How far away did it come from? And next we think about energy. And I'm going to skip over to some case studies because I'm running out of time. So I'm going to just talk about a couple of things with energy. We all know that the buildings are the most energy intensive, but engineers really need to be more conscious with the amount of sources that they're putting into the healthcare facilities. And after touring a hospital where we noticed an excess amount of plugs that weren't being used, I collaborated with one of my colleagues to go through the architectural and the drawings for the hospital that you saw earlier on here. And we immersed ourselves in them. And from this review, it was a 4-floor tower. We were able to remove 70 plugs and 120 data ports. And this was an immediate cost savings of $230K. And although we're not sure the yearly energy cost, there's no wasted power flowing to an unneeded outlet, that some of them were behind furniture. And this is a definite win for the planet. And one more case study that we did was a technical review that I did on the zone lighting. So in this review, I assessed the workflows of the overall unit and made sure the lights were grouped together into zones so that they all had the same function. So by doing this, each zone could be controlled independently or programmed to adjust the needed percentage or based on the sun's pathway. Lights on at 100%, like even in this room, are very bright and not always needed, so we want to make sure that the staff can adjust them. And we also want to make sure that we're turning our programming, the lights, if you didn't know, we can program them off on evenings and weekends. So considering the activities inside the building and the staff's workflows of how the building is going to be used is very important and can lead to energy conservation. It should be something that's considered in all aspects of design, construction, and commissioning. And furthermore, because practice changes, we need to be evaluating this more regularly. We need to get people at the table, so transdisciplinary approach with clinicians who work in the space, facilities management, and engineers. And even small practices can help with conserving energy. So in summary, there are many opportunities for implementing a planetary health lens during the healthcare facilities commissioning, and understanding the activities in the building is really important. So as you leave today, I'm sorry it had to be a bit rushed, but there's no need to return your planetary lenses. Those are a free gift. And I hope that you wear them often to recognize where you can steward the health of the planet and us people. Thank you so much.
Hi, thank you for a really great presentation. I'm curious if, given that the hospital is situated in the interior region of British Columbia that is going to experience significantly worsening wildfire seasons as we've seen over years, I'm just wondering, from an emergency preparedness and adaptation perspective, what does that look like for the hospital potentially serving as a receiving center for rural remote people who are coming because if they're evacuated or they have no access? Like, does that capacity overload sort of accommodate? Is that taken into account into planning that you might have come across in your region or that you've heard about? Because I know that provincially we're still not where we should be from an adaptation perspective, and that's where, like, we've done a lot of great work in the mitigation area, but we have a lot of catching up to do with the adaptation. So I'm just curious as to, like, how does that look like?
Yeah, it's a very good question. And definitely something that we think about in the planning phases, knowing that the climate is changing and that we need to have more air-conditioned resources because we do see a lot of elderly coming in. So these healthcare facilities expand and they get new rooms and they get new kind of multi-purpose rooms that can be used for just this. So we actually have emergency operating center in this facility. We have various rooms that could be converted, but we're always thinking about that, and that we didn't necessarily design it that way, but now we have to be thinking about those things. So we have some resiliency, I would say, in the building to do that, but it wasn't necessarily a focus. So now that we need to be encouraging this and implementing it more, like, because these things are going to happen. So yeah, a really great question.
That was an amazing talk. Thank you so much. Very positive for tonight. One thing I was curious about, and maybe outside of your purview, so apologies, like supply chains. So thinking about when you're building a hospital, what happens if there's really bad flooding or fire and the hospital can't access laundry services or food? Is that something you look into when you're designing, like supply chains feeding into the hospital?
I love your question because this facility, I'm not naming it, but it had major flooding like a couple of years ago and it was crazy. But in terms of supply chain, that's something I think the authority is looking at. I'm not involved in that work, but there's things that I've been reading about, just even the materials building the facilities, like where those coming from, and they should be closer. But yeah, it's going to be interesting. Something that we're doing, I can give you an example, is right now we're laundering curtains, and curtains are traveling. And when I was thinking about how far they're traveling to get laundered and come back, I was like, this is ridiculous. And our infection control nurses are working to get rid of curtains. So then I'm like, let's do this. So now, we designed an emerge and it has no curtains, and they had one curtain in the dining room, and we forgot to install it. I'm like, oh, you guys, you have to install this curtain. They're like, yeah, we don't want it. I was like, okay. So we have no curtains in that emergency, and we're really moving forward with that, and especially laundry because it does it travels to get cleaned and come back. But yeah, definitely supply chains right now, that's going to be interesting because our major warehouse is in Kelowna, and all the way to Williams Lake, and it's 6 hours. So it's not the greatest. And then with the new facility, they're talking about increasing the route double now, like 2 times doing deliveries, right? So that's alarming when you're thinking about the environment. So we might have to see if we can, we've been working in the hospital to get a bigger room so that we can have a separate room so that the delivery amount can stay the same. that makes sense. Okay. Sorry to go on and on.